Hi, Hannah. Thank you for being here. Hi, Dance. Thank you for tuning in. Alrighty. Hi, Misty. Thank you for the blue hearts. Okay, got a good crowd going. And that's great for a Friday, right? Always great for a Friday. Hi, Yvette. Thank you for the blue hearts. And I, of course, am drinking my coffee. Hazelnut, Dunkin' Donuts. Not an ad, but I'm trying it and it's so good. Hello, Seamless. Oh, I saw a lot of blue hearts. Monty? I hope I said your name right. Thank you for all the blue hearts. Mm. Yes, Tabitha, it is Friday for a long weekend. I'm off on Monday, so I will be here live. I told an audience member that I would be talking about the CPMA tonight. I would discuss it, but I'm gonna put that on Monday's episode because I want to do some more research for the CPMA, and that is the hi Tangela, hi Regina. Okay, good. I'm so glad, Monty. Hi Christina. Uh, yeah, I need to do some more research on that certification, so I want to make sure I have all my ducks in a row. That'll be Monday's episode. So tonight I am having an open chat, so it's whatever you guys want to chat about. I have some comments that I need to get back to that I'm gonna address here while I have everybody. But if you have any comments, you can leave them in the chat box and I will get to them as it is a open chat. And I am going to be clarifying why I do not recommend fast-paced medical coding programs. I talked about that the other day when I wasn't here. I had pre-filmed the episode, and so I wasn't able to get that to do that engagement like I normally do, and I seem to have confused some folks. So I'm going to clear that up. But since we are all here and we've got a good crowd going, I'm going to go ahead and start. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Tonight I am talking about why I do not recommend fast-paced medical coding programs, and the total time being like less than 6 months. Okay, that is what I am referring to here. The other day, hi Amelia, thank you for joining me. Rossi, I hope I said that right. Thank you for joining me. So the other night I talked about these fast-paced medical coding programs. Oh, that you can be on your way to a brand new career in just 16 weeks. You'll be on your way to being a medical coder, a certified medical coder. Because if you're doing your research, you will know or you'll see that there are some programs that are just basically training you to pass a certification exam, and then you have your certification. The school looks really good because they have another person who passed, and so that is what it is it is a business. They want you to pass so that their school says, okay, we have a very high pass rate. That's going to get us more students, and it's going to get people to think, oh yeah, I can be a medical coder really easy. This is the thing that I want to tell you guys, to just slow down. Okay, when it comes to learning medical coding, grasping what's going on, getting beyond that whole thing of, oh, I know enough just to pass the certification exam. Knowing more than that is what you need. And see, here's the problem. Because schools have done this for so long, and they've just basically cattle herded people out of these schools. They get them through, get them to pass, because they basically teach them strategies of passing a certification exam for medical coding, and then they're out in the real world, and now you're the employer's problem. And so now the employer has to have it fall, the burden of training falls on the employer. The burden of training falling on the employer should only be up to a certain amount. It should be basically covering like the electronic health record and their systems and their processes and things like that. That's what employers should be training their new people on, and which is what they do. But when it comes to medical coding, because these schools have done this for so many years and so long, they've just cattle herded people out. This is why employers are telling people, we don't want brand new people who do not have any experience. We want people who have experience, because they don't want to have that burden of having to train new people. That's the problem. So that's why I tell people, even when you're brand new and you don't have experience, you still need to apply anyway. And I also say in the same breath that you have to continue to study. You have to make ways for yourself to understand, because it's really on you to get it. And yes, in the beginning, there's going to be some things that don't make sense, because I'm going to tell you right now, book coding and real world coding are two very different things. In the book, you have tons of really good, helpful information, and it's basically leading you to the answer, and it has all of the details there. In the real world, you're going to get providers who will document one of two ways, like beautiful poetry, the most beautiful documentation you'll ever see in your whole life. And then you'll get providers who are going to give you the bare minimum. I'm the doctor. I'm going to do whatever. I'm going to write however I want to. I don't care what anybody tells me. This is the note that I'm going to write, and I expect a high level for it. Okay. No. We need to slow down here. This is why I tell coders, it doesn't matter who you are. If you're in this business and you're a medical coder, you need to work with a provider. And well, Blue, I'm a shy person. That's not an excuse. I'm shy, believe it or not. Somebody who comes on YouTube and has this personality of being on YouTube and goes to work and and deals with all these providers. Yeah, I am very shy. I can turn beet red in a minute because I get that level of shy. However, when it comes to medical coding, oh no, that is where my shyness falls away, and I get into it and I start talking about it, and yeah, that's when I really get focused on what I want. It's the same way you have to be when you are in this business. And just because you are a certain way does not mean that that's always going to have to translate to your work life. Okay. So the reason that I don't recommend these fast-paced medical coding programs, the ones that are less than 6 months, the ones that say, 16 weeks, I don't recommend those, because it's too much information packed all into one sitting, and then you go and you get your certification and your head is still spinning from all of the information that you had jam packed into 16 weeks. Some programs are the whole kit and caboodle. Like they'll say medical terminology, anatomy, patho, and medical law and ethics, the coding, the diagnosis coding, and the procedure coding, right? Because they're sure as heck are not going to try to teach you inpatient coding in a 16-week period, okay? But they are going to teach you the outpatient setting and E&M and modifiers and HCPCS and all this other good stuff crammed into 16 weeks. Oh, Blue, well, I can do it. I'm a really good studier. Okay. Then you get your certification exam. Okay, well, I passed it using their test strategies, right? And then when you get on the real world and you get that assessment test, hey, we need to test you on your skills. We're going to test you on your diagnosis coding, your procedure coding. We're going to give you a little bit of medical law and ethics. And oh yeah, we're going to see where you are in medical terminology and anatomy as well. And you can't pass it, now you have a problem. And I will always advocate for 9 months, 12 months, or 18 months. It doesn't matter what background you have, because I've gotten emails, I've gotten messages from people already in the medical industry. Blue, this is a cakewalk for me. I know my medical terminology. I know my anatomy. Okay. All right. You do realize these codes, these guidelines, everything else in coding, it gets updated every year. It gets updated every year. You have to be able to comprehend what's going on. You have to learn outside of the box. You have to learn outside of your coding manuals. You have to learn outside of these workbooks. And when you get in the real world and you start seeing there's all this other stuff, you're not going to get it. And you're going to feel that lost feeling just like that. So I want people to be set up for success. I will always advocate for 9 months, 12 months, or 18 months. Doesn't matter if your background is already in medical, it does not matter. I will always advocate for that. If you make it through in less time, that's great. If you feel confident and you're a savant and you basically understand it walking in, that's good too. I'm happy for you because that doesn't always happen. But at the same time, again, my channel, and I want people to be successful. I don't want people to be taken advantage of. And when I see these programs promising all these big things in 16 weeks or in 6 months and you'll be on your way to it, no. That's when I have to side with the employers that say, well, we don't want new people because we've had people who got shuttled through these programs that can't code. They can pass an exam, but they can't code. I want people to be ready for success. Well, Blue, what about 8 months? What about 8 months, an 8-month program? Because they said, well, AAPC, the coding part is 4 months. Yes, but they also have the separate bundle for the anatomy and medical terminology, which makes a total time about 8 months, right? Give or take 8 months. And so that's okay. I'm always going to say that going through the associations is fine. Now, AAPC's portion of the coding is a little fast for my preference, but it's still okay because it is still with the association. If you're going to spend the money to learn, and you're going to have to learn on your own anyway, going through AHIMA or AAPC is, like I said, it's a good option. With AHIMA, it is all self-paced. They give you 12 months to finish the program. So if you wanted to go faster, if you wanted to go slower, take a little bit more time, as long as you get it done within a year with AHIMA, then you're good. Okay? So I recommend that you take the time to really kind of understand. 9 months is great if you get a program like that. 8 months, again, 8 months is just a month shy of 9 months. And that's fine if you're going to go that way, because you don't necessarily have to sit right away for your exam, right? You can take the time afterwards, after you get done with your program, and then sit for your exam when you have had more time to study, like a month or so to study, then you're good. Okay. Now, if you find yourself in one of these fast-paced medical coding programs, I keep getting this comment too. Well, Blue, I just signed up for a 16-week program, and now I'm so devastated. Should I drop out? There's no refund. Okay. Why would you drop out? You just signed up, and yes, you heard me say that I don't recommend it. But I've also said at the same time in the same video, if you find yourself in a fast-paced medical coding program, stay with it. It's going to go fast, but you got to stay with it and study on your own. Supplement your studies, because when you do that, then you're going to set yourself up for success. I don't recommend fast-paced because it's too much and it's going to burn people out, a lot of people out fast. So that's why I tell people, if you're in it, stay in it. You've already paid for it. Get what you can get out of the school and move on. But know that you're going to have to do a lot of this study on your own. So that's why I'm telling you guys, if you're going to get into these programs, it's your money. It's your money. If you're going to get into these fast-paced medical coding programs, by all means. But I'm telling you, the reason that I don't recommend those is because it's too much information. You're going to be lost. And even if you are from a medical background, I get that too. Well, Blue, I'm a nurse. I should be able to do this. Believe it or not, nurses get lost too on this. And I've had to train. I know, because I've trained and I've tutored many a nurse. Trust me, I understand that this medical coding is something that is not really readily understood unless it's very well explained. If it's very well explained, then you got a fighting chance when you're getting into this to actually wrap your head around it. Or if you've had somebody, you have somebody that's with you that can kind of walk you through it and explain it to you, then that's something a little different. But when you're just sitting there just trying to fly through because you want to hurry up and get through a program, hurry up and get your certification so you can hurry up and get out there and start working, I understand. I understand the need to want to start working, because trust me, when I was working the 2 and 3 jobs that I was going through while I was in school, trust me, I didn't want to do any of those jobs either. I worked at a concession stand. I worked as a housekeeper. I worked as a bartender. So I did all of these physically hard labor jobs that I didn't want to do anymore. And I resented having to do them because I just wanted to code, because that was what I was being trained for. So as hard as I was working, I still did that, right? Still studied in school, but I still did these other jobs here. So I understand when you say you want to hurry up, but at the same time, there's nothing worse than being right there and saying, okay, here you go, code all these, and you're just sitting there like, where do I start? How do I do this? So that's why I want y'all to be set up for success. I will always want y'all to be set up for success, and I will always advocate for people, whether they're going to argue with me or not. I'm going to always say, take it slow. Go 9 months, 12 months, or 18 months. 8 months is fine. You don't have to sit for your certification exam right away. Just make sure that you're taking the time to understand what's actually happening. That's all I'm going to say on that one, because like I said, I just want y'all to be set up for success. At the end of the day, I'm going to say things that you're not going to like. And you're not going to like me the second I say these things. And that's okay. You don't have to like me. I know that I did my part, because these other schools out there, these for-profit schools, these businesses, they're not going to tell you that. They're not. They're going to take your money and they're going to tell you, they're going to sweet talk you, whatever they have to get your money. And I'm not trying to sell you anything. I'm not. All right, so what do we have here? Misty, I am an AHIMA CCA student. And thank you for the blue heart. And I'm curious about what the major difference is between the CCA and the CCS. Also, is it true that you only get one chance to take the CCS? No, that's not true. You get one chance per payment, but you don't only get one chance to take it. I don't know who told you that, but I'll get back to your question. Hi, Katisha. Moni says, you are correct. It is overwhelming. Katrina, hi, Blue. I tried to make it on time. I'm on the East Coast. Well, you're here. Carissa, you got the job. That's so awesome. I got the coding job yesterday. I forgot to even ask them what the dress code is. Do some coders wear scrubs? I'll come back to that one too. But lots of congratulations for Carissa. That is amazing. That is amazing. Tabitha says, I was recently hired as a remote entry-level coder for a local hospital. I was told I will be doing outpatient coding. Any tips on what to study for the outpatient side? And I'll come back to that one. But Carissa, I can answer your question very quickly. Some facilities have rules about the scrubs, so I would not wear scrubs if I were you. You need to be business casual, and that is the best bet, right? Unless your facility says it's okay. Some facilities are okay with you wearing scrubs, and others are, like my facility, where we are not allowed to wear scrubs because we do not have patient contact. And I will tell you something else. The place I was at before I came here, we were allowed to wear scrubs. And I was like, oh yeah, I'm going to look so awesome in my scrubs. And I got all these cool new scrubs and everything. And I was like, oh, this is cool. So I'm going through, prancing to the hospital in my new scrubs because I'm feeling so awesome in them, right? When you hear, hey, whoa, hold on, bro. What you mean, hey, get over here. We need your help. Excuse me. I'm not a, well, aren't you a nurse? I'm like, no. A medical assistant? I'm like, no. I'm a medical coder. Oh, sorry. So you are how you dress, right? You will be treated how you are dressed. In this instance, this resident thought that they were going to be able to just, hey, and snap at me. Oh, no. You need to slow down there, bro. Yeah, no snapping. Okay, no snapping at Blue. But yeah, so business casual when you go there. Blouses, slacks, dresses, that kind of thing. Do not wear jeans. Please do not wear jeans. Not even if your other coworkers are wearing jeans. Should you ever wear jeans? Never, ever, 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 ever wear jeans at the hospital or the doctor's office or facility or wherever you're working. Never, ever, ever. Unless it's like a day, like some significant day that you can wear jeans or something like that. Other than that, you need to be in slacks, dress casual, business casual will be great, you know, because they're going to respect you more when you have a presentable appearance like that rather than, you know, just jeans and a t-shirt. All right. Misty. Elvia, and you're a Garcia too. My name is Bleu. It's all over my channel. It is the title of my channel, Medical Coding with Bleu. Bleu. Please. Please, because I'm a Garcia too. Please. Bleu. And guys, you got to start watching those details, because in coding, if you transpose numbers and letters, you get the wrong code or you get an invalid code. One of the two. So please make sure that you pay attention to the details. Watch the spelling of my name, please, because I'm going to make it a big deal. Because I'm talking to future coders or coders right now. And the details count, because you don't want to get a name wrong. Trust me, with a provider's name, you don't want to get their salutation wrong either. So name, spelling, and salutations are key, and you got to watch those. All right. There was a question I was going to come back to. What is the major difference between the CCA and the CCS? So the CCA is a Certified Coding Associate, and that is a credential offered with the American Health Information Management Association. The CCS is the gold standard of medical coding credentials, and that is the Certified Coding Specialist, right? Now, the CCA is considered the entry level. This is somebody who's brand new, typically to the industry, and they have a short exam, but it is not that it's not a difficult exam, because it is a difficult exam. When you are taking the CCA, it is still a difficult exam to pass. There were 34 people in my class. I was the only person to pass it on the first try. So yeah, it's a force to be reckoned with, trust me. But the CCA is the entry level. It's going to test you on everything, on inpatient and outpatient coding. Okay, so both of these. And it's just meant to get you in. And the CCA is a very good credential. I had it for many years. I had it in 2008 all the way up to this year. And I stubbornly held on to my CCA because I was tired of the trash talk. There's so much trash talk in this industry. Oh, the CCA. Okay, let me show you what a CCA can do. That was my attitude. And I changed a lot of hearts and minds. May have just been a few, but it was those few that had these thoughts in their head about what a CCA was and what they did, and oh, they don't know very much. Well, I proved them wrong. And so when I did, then they're like, oh, okay. And so CCAs got to be more accepted in their minds for those people. And these were people who have influence on the hiring. So that was me doing my part, right? So now I hold a CCSP, not that you asked, but I'm letting you guys know. I have a Certified Coding Specialist physician base. This is the mastery of the outpatient setting coding. Okay, that is what that credential says. The CCS is gold standard, like I said. A lot of employers ask for this. Like 100% of the employers I've seen have asked for this. This says that you have mastered the outpatient setting and the inpatient setting. The exam is longer. It is 4 hours. So that is something that you have to know when you are taking these exams. You get one chance to take the exam per fee that you pay, okay? It's not like with AAPC. AAPC has the some of their things have the option of if you're going to the place where it's proctored, if you fail, then you can take it, you get a free retake. With AHIMA, you don't have that. We don't do that. So that is, it is one test per fee. If you fail, you have to pay to take it again. And as far as I know, there's no limit on it. But there is a time that you have to, there's a time delay from between tests. So you have to wait. If you fail it, then you have to wait a certain amount of time, and then you can retake it again. But yeah, you can. I've seen many people take the CCS quite a few times, and then they were able to pass it. So I mean, it really all depends on you. It depends on your training, but that is the major difference between the two. Okay, so one is the mastery, the CCS, and the other one is the entry level, considered CCA. But they're still both very good credentials because they both cover inpatient and outpatient coding. Okay. And then I was recently hired as a remote entry-level coder for a local hospital. I was told I will be doing outpatient coding. Any tips on what to study for the outpatient side? Everything in the CPT manual. Because you're going to have E&M coding, the Higgs picks, and then of course your diagnosis coding. So you've got to follow the outpatient rules, look at your coding guidelines, and that's going to really jog your memory on the things that are acceptable. We don't code things in the outpatient setting that are ambiguous. Okay, we code things that are absolute. What we know. If there is no definitive diagnosis, then we're going to pick up the definitive symptoms. What do we know that are the symptoms, right? If they say probable, suspected, likely, maybe, could be, any of those words, then obviously that's going to negate that diagnosis. We're going to go with what we do know for sure, which is the symptoms. This is different from the inpatient side, but with the outpatient side, we code what is there. We code what happened on that encounter that day. We don't reference old encounters, okay? We don't do none of that. What's in front of us is what happened to that patient on that day. So that is what we do, and I recommend going through your workbooks, going through justcoding.com, which is an invaluable, is it valuable? Invaluable. Valuable? Valuable resource in studying, right? Because they do, if you sign up for their free subscription, they have a free subscription and a paid subscription. The free subscription gives you access to 5-question coding quizzes, and it covers diagnosis coding, ICD-10 PCS, inpatient procedure coding, and CPT coding. So I think it's a really good deal. It's a free subscription and you get access to that. Come on, you know, I mean, that's an awesome deal. And before you say, well, it's multiple choice, so it's really easy, doesn't mean you have to look at the answers, right? You can cover up the answers and you can use your book to reference that question and try to look up the answer yourself without having to look at the possibilities that it is, right? And then you get in there and you can see, you know, if you got the answer correct or not. And then if you don't, if you're completely off track, then you can kind of see where they were going, what they were trying to do, okay? So that is something that you can do to help you study. I always recommend getting workbooks. When I update the description box of this video, you will have a ton of books that I recommend. They are the Amazon affiliate links. You do not have to click on these links. That's why I have the titles already there. So you can go wherever it is that you go to find your books, whether it's eBay or even on Amazon. Obviously, the link is there. So you can check it out, or if you go to a local bookstore, at least you know what I use. So that would be what I would recommend. Thank you, Elvia. Hey, all right, Garcia's in the house. You're welcome, Misty. Malia says, what's the free subscription? Sorry. For Just Coding, justcoding.com, all together, justcoding.com. They have a free subscription and a paid subscription. And the free subscription gives you access to 5-question coding quizzes for diagnosis coding, procedure coding, and ICD-10 PCS inpatient procedure coding. So lots and lots of really good resources there. That's what I would recommend. There's lots of really good things. Of course, CMS has lots of free downloadable resources. CMS is an amazing source of information, and obviously a lot of the stuff comes from them right away. So that is a really good thing that you want. They do have the global surgical booklet that you can print. You can download and print it out. It is really good, and it explains the 0-day global, 10-day global, 90-day global. How many days is in this global period? It is a really good resource. I love this resource. So lots and lots of information there at the CMS website, cms.gov. And you can reference the Medicare Learning Network. That's what it's under. So Medicare Learning Network, and all of their booklets and pamphlets and downloadable resources will all pop up. It's okay, Ellie. Thank you for tuning in. But yes, Malia, that is my recommendation there. Let's see, what other question was I going to answer? Let me go to these comments. Okay. Well, one thing I was talking about the other night was how to gain work experience as a brand new medical coder. There's a little bit of confusion going on because sometimes people think that Practicode, which is an educational product that is offered with the American Academy of Professional Coders. Practicode, if you don't know, is a educational product that is designed to help give the coder more experience, and there is a cost for it. The benefit of it, though, is that you get this practice with coding real life redacted records, right? No private information is on this, but you're just going through and you're coding. There's no options, like it's not multiple choice. You have to code it yourself, and once you complete that whole project, right, for this Practicode, then you will have 1 year of your 2-year time commitment to have the apprentice status on your credential for AAPC. If you take the CPC, or the Certified Professional Coder exam, you will have a -A for apprentice for the first 2 years. And they've said, okay, well, we can help you speed up this process if you go through this Practicode program. Practicode has a pretty good price tag on it. So some people will say, well, I want to hurry up and get rid of this A designation because I can't get a job with the apprentice designation. This isn't true, because even at the beginning of the pandemic, there was lots of people who had the apprentice and they were still able to get jobs. It's really on the individual. And I go into so many videos about applying for jobs when you're a brand new medical coder. But going through this with this Practicode, and if you're working, when you do get a job, right? When you get a job and you don't do Practicode and you work for 2 years, and then you can apply to have this apprentice taken off, right? You've already gotten a job if you're an apprentice. So why do you need to rush the experience, right? Why do you need to hurry it along when you're going to get it removed anyway? And well, Blue, I really want the practice. That's what these workbooks are for, right? You can get workbooks. And there's tons of workbooks out there, guys. And like I said, when I update this description box, or you can look at any of the description boxes of my latest videos, and it's going to give you these workbooks that I do recommend. You can go through those workbooks and work through them just the same way as you would through Practicode. And so, but some people are misled, right? Somebody tells them this and somebody tells them that. So they think that if they do this Practicode, that they can put on their resume that they have 1 year of coding experience because they've gone through Practicode. And that's simply not true. And what I was explaining in the video is, in order for experience to count, you have to have production standards and accuracy standards in order for work experience and medical coding to count. And if you don't have those, then it's not something that you can say, oh yeah, this is definitively that I had work experience. Because when you tell an employer, oh yes, well I did Practicode, I was an intern for AAPC and I did Practicode, they're going to understand what Practicode is. They know what Practicode is. And so, like I said, don't get caught in a lie your first time out of the gate, right? That you're trying to get a job, but you're trying to like kind of fluff your information and say that, oh yeah, no. And it's better to take the alternatives. And again, my battle cry for the month of October, and I'm going to keep saying this, which I I talked about it yesterday when I talked about it on this video, how to get work experience. But this part I left off. When you're brand new, apply with a temp agency that is specializing in medical professions. Why? Because they'll give you assignments, right? Like they'll give you a test, and they'll, you know, there's a good chance they're going to send you on assignments. This is what happened to me, right? I registered with the temp agency. They got me an assignment. It was a 3-month assignment. So I had 3 months of work experience that I could put on my resume. And it was in the oncology. It was for the Cancer Therapy Research Center. Hello, first time out. cancer coding. Okay, great. So I have this experience now. I had E&M, diagnosis coding, HCPCS coding. So I had all of this experience already on my resume. Then when that job ended, they said, okay, well, we have another, we won a contract. And if you want this job, you have to move away from here. I had to move 8 hours away from my hometown. But you'll have a job, and it's paying even more money. So I was like, okay, you know, that I didn't want to go. My mom made me go. So, but I went, and you know what? Moms are always right, because my mom said, no, you're going to go, because if you stay here, you're not going to get any work experience. Go so that you can come back. And that was my whole plan, was to come back home. So when I was there in this other city, I was there for 8 months, and that experience led me to this hospital that I'm working at now. But I gained experience working in the prophy clinic over there. So going from neoplasm coding to prophy coding, now, hey, you know, now we're cooking with grease, right? So I have more experience to put on my resume. I did not have 1 year, 1 whole year yet before I got this job here. And I have it all to thank to the temp agency. Now, a temp agency, you want somebody that's going to advocate for you to get a job. Who better, right? Who better to advocate to help you get a job than the temp agency? Didn't think about that, did you? The temp agencies are only going to get money if they get you a job. So now, not only are you trying to get a job, you have somebody else that is actively out there trying to find a job for you, right? Because they're out there, you know, putting out their information. They're saying that, you know, their advertisements and things like that. Well, we have coders, and, you know, we have billers, and we have all these people, because they are going to test you. So they're going to need to make sure that you still have good enough skills, because at the end of the day, it's sort of a try before you buy, right? Because these employers can say, well, you know, we want to try out a coder, but we don't want to have to hire them yet, because we don't have to go through all this process and spend all this money. So we're going to go through a temp agency. It's going to be a little bit more money, but they're going to go through all the background with them. They're going to, you know, send them for all the screenings and everything like that. They're going to do the background checks, but we're going to be able to see how they work. And if we don't like them, we can just send for another person. And that's when you come in, right? That's when you come in and you act, and you go in there with a good attitude, and you be excited, and you do things that are going to highlight all the good skills that you have. Being there and asking questions when it's appropriate, doing your research, so that they say, okay, this person, they're brand new, but they don't need a whole lot of hand holding. That's what we're looking for. We're looking for somebody who can work on their own, but yet still work in a group and that kind of thing. So you have somebody advocating for you when you're registered with a temp agency, because they're going to want to send you out on assignments, because they want to get paid too. And if they send you out, yeah, there's a nice dollar on your head, right? Because they're going to make good money from you. But you do good for them, they're going to put you on more assignments. And if you say, oh no, Blue, I'm not doing that, that's not for me, I want a real job, that's why I did this. I was the same way. Until I said, okay, well, what I'm doing is not working. What I'm doing is not working, which is applying everywhere and basically being told to go pound sand. So that's why I was like, okay, well, let me go ahead and try this then. Let me go ahead and get myself in with the temp agency. And you know, when they told me, oh, we'll give you a call in about a week, I was like, they're just going to blow me off. And I'm like, nah, you know, I was like, oh, I'm just going to keep applying. That's all I can do. And then when I got a call, hey, we have an assignment. Would you like to go work over at the Cancer Therapy Research Center? I was like, well, yeah, I'll take it. And they said, okay, if they like you, they'll keep you at the 3 month mark. If not, we'll find something else out. So, that was how I got it. So that's why I say for the month of October, that is going to be my battle cry for you guys to register with the temp agency. Not just one temp agency, but several. And the temp agencies that you want to sign up for is not like the day labor place, right? But it's the one that is specialized in medical professions. So you can Google temp agencies for medical personnel in your area, and it should pop up. I did this for the city of Dallas, and I was like, okay, I'm not in Dallas, but I wanted to see if, like, in a major city, like how much of it would pop up. And there was tons that popped up, and I saw several that said, we look for medical billers and coders, we look for medical coders, and we're looking for remote coders and that kind of thing. So I was like, okay, so I know it's out there. So I wouldn't share something here without telling y'all, without me looking it up first to make sure that I understand and I know what's going on, right? All right, so Katisha says, I just got hired as a remote HCC coder. I have been coding for 6 years as an inpatient DRG auditor. Nice. I'm trying to see what I might need to refocus my attention to. I know HCCs are driven by diagnoses. It's all diagnosis coding. That's it. All diagnosis coding. Misty, are there abbreviations on the CCA exam? You mean, like, are they testing you specifically on abbreviations? Or are you asking me, are you going to be seeing abbreviations throughout the exam? Because that could be taken two ways, right? Katrina, I've been thinking about changing from AAPC to AHIMA for the CCA or the CCS. I haven't passed the CPC exam yet, but did take terminology. Would a change void everything I have completed with them? I haven't taken the CPC exam yet. I did take terminology. I don't understand your question. Would a change void everything I have completed with them? You're still in the program. AHIMA has nothing to do with AAPC. So if you signed up to take the exam with AHIMA, they don't know where you got your training or that you've been through a program. Am I losing? Would leaving AAPC void everything I already did with them? Maybe because it's Friday. Why do I not understand your question? Would the change void everything I've completed with them? Changing memberships. You've already paid for your membership with AAPC. You don't have to be a member of AHIMA in order to take their certification exams, okay? They have a member price and a non-member price. If you could be a member with AAPC and decide that you want to take an AHIMA exam, and AHIMA doesn't care, because AHIMA says, well, if you're a member, you get this price. If you're a non-member, you get this price to take the certification exam. So in AAPC, well, I mean, they may not be happy that you take a AHIMA exam, or maybe they don't care, they already have their money from you. So they're going to give you whatever it is that they're going to give you for being a member. So if you've paid for your membership with AAPC and then you decide that you're going to take your certification exam, great, because you've already paid for your membership fee. You have to pay that membership fee before you sit for your certification, right, with AAPC. So, or before you pay to take your exam. And when you do that, then you're good there. But if you pay for your membership with AAPC and decide to sit for an AHIMA credential and you don't do anything with AAPC, well, then AAPC already has your money. So, I mean, I don't see what the deal would be. right? It wouldn't void anything by going to another association. At least that's what hopefully I'm taking your question the right way. Christina, AAPC has codified to practice coding. Are you familiar with this? Isn't that like an encoder type product? Human, hi Blue, thank you for the blue heart. How did you manage the balance between work and school? I'm a mom and I work 30 hours a week. I'm in the HIT program at the local community college, and sometimes it's overwhelming. Well, I mean, I totally get that. And striking that balance is a very fine line sometimes. I get it. But what I tell people that are going through this time is that it's just temporary. It's just temporary, and it's not forever. So while it is a lot, it's leading you towards your goal. There's going to be times in life when you're going to have a lot of things compacted into one particular set of time. And then there's going to be times when there's a lull and there's, everything's okay and people are just going along their lives and their families and things like that. And then everything hits all at one time again. What I tell people is to make sure that you have time for your family. Make time for your family, because otherwise they will make you make time. If you don't make time for them, they will make you make time. Squeeze in the time that you have. You work 30 hours a week. Well, if you commute, right, in the morning, let's just say, for example, you get 30 minutes in the morning to commute, right? You're going to your work, and then it takes you 30 minutes to get home. That's 1 hour. While you're driving, you can listen. You can listen to podcasts. You can listen to YouTube, CMS, things on YouTube. They have HIPAA videos that you can listen to that will help you to study. You can record yourself reading the guidelines, so you can listen to that in the car. If you're working and you have a 30-minute lunch, you can listen to something while you're eating lunch. And so there's pockets of time, because in a 5-day week, right, you have 1 hour each day. That's 5 hours already. That's 5 hours you squirreled in where there's nobody around you, and you can be listening. You can be working on those things. You can go home, and if you're not going to study every night, then you need to make time where you are having either to get up earlier or to stay up when the kids fall asleep. Then you can do your studies and make that time. If it's important to you, you'll make the time for it. And give yourself a break. Make sure that you're hydrating yourself with water, not just coffee. If you're a coffee drinker like me, make sure that you drink plenty of water. Make sure that you're taking care of yourself. You eat breakfast, lunch, dinner, whatever you do. Some people skip breakfast. If you skip breakfast, that's fine, whatever. Eat things that are healthy, not things that are going to give you make you sluggish. Like, don't eat too much greasy foods. And try to make sure that you eat things that are balanced. Get some healthy things in there, some vegetables and some fruit, so that way you have those vitamins to keep you going and study, and you have something that you are taking in, and it's not a pill or not a drink or anything like that, but it is actually something from the actual plant. But eating well is key to this. You have to be able to stay balanced, and that's going to keep you from feeling overwhelmed. Don't depend on candies and chocolates to kind of get you going and give you that perk up, because if you do, it's a slippery slope, and it'll lead to a crash. You won't. It's not easy to recover from those types of things, right? So just make yourself have the time. You can have the time. It's a lot of things, yes, and it's a lot on your plate right now, but it is not permanent. So keep that in mind. It's not permanent. And I think that when you have that in your head and you have this goal in mind, like this is what you want to do, you're in this program, you're going to do it because you're doing it for not just yourself, but for your family as well. It does help. It does help to keep you focused and keep you engaged in what you want. At least that's just my advice. Hi A, thank you for the blue hearts. Katrina, would leaving AAPC void everything I've already done with them, changing memberships? A says, I think they're asking if they still have to take medical terminology with AHIMA. Oh, okay. If they already took it with AAPC, maybe. Oh, okay. So when you look on the AHIMA website for the prerequisites, you'll see that these things are recommended, but they're not required. Okay. The only thing that shows it is required is if you're sitting for the CCA, it does say a high school diploma or a GED is required. Everything else is recommended. The recommendations all recommended. Thank you for clarifying that. That makes sense. That makes sense to me. Maxima says, I'm 6 months into study. Yesterday, I coded 77 scenarios, 2 hours, 42 minutes. I passed with an 86. However, it was difficult. I'm thinking I'm going to test in November, but just keep studying. Yes, that's right. Katrina says, okay, that is what I needed to know. I thought I had to change completely in order to do the CCS or the CCA. You said CCS or CCS, but I admit, yeah. Oh, never mind. I was confused too. Okay. Sorry, Katrina. Sorry if I didn't say that better. Like I said, it's Friday. Maybe that's what it is. Sorry. I was thinking of stopping my membership with AAPC and going with AHIMA. You've already paid for it. Don't stop it. Get what you can get out of it and, do your own thing. But if I don't have to, no sense in complicating things. That's right. Christina, with where I am in my program, I'm almost at the end, and I'm aiming to be done by the end of October with the practicum, then the final. Oh, good. At least you have your goals set. That's awesome. That coffee is good. All right. It's a hazelnut coffee. It's so good. There was somebody's question on here on the comments that I was going to add to today's show. And what was it? She says, hi Blue, I passed my CPC exam last year. I did an online coding program. I'm not confident that I will be able to code if I get a job. Do you think I should go to a community college and do the program again or start applying for jobs anyways? Please advise. So I recommend studying. If you feel absolutely that you need to go back to a program, going back to the college program doesn't necessarily mean that you're going to get that hands-on instruction. It could be just that you are in front of books or in front of a program again, and you're basically learning on your own again. You can do that same thing with just studying from your books, okay? So it really all depends on what you want to do. If you really feel that lost, I would recommend, trying to find a mentor, trying to find a tutor, and seeing what your problem is as far as not feeling confident. Okay, going through the workbook, going through sites like Just Coding so that you get that free practice, and going through there, reading the guidelines, and it will help to supplement your knowledge that way. Okay, the more practice you get with these workbooks, the better you're going to be. So that's why I tell people, and that's why I tell people every single time, do not go through these fast-paced medical coding programs, because you're going to feel like this. You're going to feel like you don't know. And so that's why I want people to take their time when they're learning so that they don't go through this, because it's going to be more expensive, right? In the end, if you have to go back and do a whole program all over again. Or if you're going through the workbook and you find yourself, like I said, if you find yourself that you absolutely do not understand, try to find a mentor who can explain it to you. If you need to hire a tutor, go ahead and do that. It's an investment in your future. Now, there's tons. If you are on LinkedIn, there are a ton of medical coding tutors out on LinkedIn. I am a medical coding tutor myself. So my rates are in the description box when I update the video. It's very reasonable, and we meet over Zoom. And so that way you can share with me what it is that is your problem, and we can work from there. I don't come up with individual lesson plans, but if I do have a resource that I have that I can share with you, obviously I'm going to do that. When it comes to what tutoring is like with me, I do have some feedback on LinkedIn, but with the tutoring, I generally break down what it is, right? Whatever your question is, if it is scenarios that are in your book, and you say, look, Blue, I didn't understand this. And so what we do is we talk it out. I break it down into a way that it hopefully is helpful for you to understand. And so I feel like I have left people a lot better than I got them. Because when I explain things, I like teaching. And there's people who really like and love to teach, which is what I do. I love to teach. That is my favorite thing. Whenever I have to teach my providers, it's like the best day. It's like when you're in school and you had your field trip days, right? And you were so excited about the field trip days. Field trip days were like the best days, right? And you were so excited about them. And so that it's the same thing for me when I have to give classes. It's like a whole field trip. Or we used to have, in school, we used to have reading. The whole day was reading, and I always look forward to that. And it was, they only had it 2 times a year, and you got to bring in a sleeping bag, you got to bring in your favorite book, and you could bring like a little flashlight, and they would like turn off the lights, and you can be with your flashlight or whatever. And you brought snacks, and it was like a big slumber party, and all you did all day was read. That was the best day. And like I said, there was 2 days out of the school year that they did that. And I think, gosh, that was like in maybe 4th or 5th grade when we did that. Oh, those were the best days, because like all I did was read. And yeah, there was people who didn't want to read, but like I was really into like the Babysitters Club and all that kind of stuff at the time, and all like and I was just reading all day. But anyway, it's the nerd in me. But look, so when you're little, right, all the things that you do when you're little, some kids like they like to play with like a Play-Doh and stuff like that, and they end up being like bakers and stuff like that. So all the things that you did as a kid kind of leads you to what you were doing like in your adult life, right? And so I read for a living. And I really love what I do. Now I have my own space, my own office, which is nice. So I get to close the door. I don't turn off the lights because it does bother me, like when I can't see. So I do have my lights on, but I do listen to music, and sometimes it is classical, sometimes it's country, sometimes it is pop music, sometimes it's music from 1998, 1999, 1997. So it's whatever I want, and I'm jamming out, and I'm doing my own thing, and I'm coding, and it's like that. It's like those days. So but anyway, let's see. But yeah, that would be what I would recommend. If you're not confident, find a tutor, somebody that'll help you. Clara had asked about the CPMA. I will talk about that on Monday. And Katrina, I got your comment. Oh, about the CEUs. So Katrina said, hello, Blue. I'm new to your channel, and I try to watch all of your wonderful videos as often as I can. Recently, I took my CPC, and I was so sure that I had passed, that I had already started looking for CEUs, and I was thinking of taking in order to maintain my credentials. So when you have not taken your certification exam yet, do not do anything with CEUs, continuing education units. And although you may be doing something that will give you continuing education units, it's fine. But just know that when you get your certification, the day that you get your certification is the day that you can start doing CEUs, right? The day that you find out that you pass, that's the day, or the day that you pass is the day that you can start getting those CEUs. If you get them before, they will not count towards your requirement. So CEUs can be very expensive, and I'm gonna have to do a whole thing about that by itself on an episode, because that would be better to break down on an episode. So I'll do that one probably on Tuesday, since I already promised Clara I was supposed to do it tonight, and I didn't see her in the room. So hopefully, hopefully I got that. No, she's here. Oh no, she's here. Sorry, Clara. I was just saying that I was gonna do your show for about the CPMA on Monday, so that way I can have time to break down all of the information. So that way I can leave information in the description box, because a lot of people will ask. I know I'm gonna get that question a lot. But yeah. Hi, Clara. A says, I'm doing a 16-week course with AAPC, but they do have extensions you can buy, which is what I think I will do, so I can have extra time with the material to study. A says, I have 2 attempts at the attempt already included with my program. Ooh. Katrina, you were going to talk about CEUs tonight and how to best select them, unless I missed that coming in late. And I just talked about that too. That's funny. Tangela says, I take my exam in November and I scheduled a second one in December just in case I didn't pass the first time. Why do you put that on yourself, Tangela? Make sure that when you, the energy, before I read any more comments, the energy that you put out into the universe is what you're going to get back. If it is uncertain energy that you are putting out into the world, you never know what's going to happen. And yes, well, I understand that you want to make sure that you have a study, not a study, but a test date for the second time in case something happens. Give yourself the opportunity to say, I'm going to pass on the first try. I'm not going to need that second test date, okay? Because all it's going to do is mess with your head. Well, I know I can fail this first one, so I have the second one in mind. And then when you get to that second one, then you're like, oh no, well, wait a second, So believe in yourself. And the energy that you got to put out is positive energy, certain energy that says, I'm going to pass this test the first time. I've studied. I am going to learn all I can learn. And then I'm going to not study a couple of days beforehand, because cramming is the worst thing that you can do to yourself. Before you take your certification exam, do not study at least a couple of days beforehand, because what are you going to do besides make yourself even more nervous? So take the time to rest. Take the time to rest so that way you can go in refreshed when you go to take your certification exam, and then you got it, right? But if anything, if you have to go back and take it again, that's okay. But let the first thing be certainty with you and your own skills. Yes, I can do this. Yes, I'm going to pass. Yes, if I need to take it again, it's fine. But I'm not going to set myself up for, oh yeah, I'm going to go ahead and schedule it anyway because I feel like I'm going to go ahead and fail this first one. Don't do that. Have more confidence in yourself. You can do this. You can do this. You can absolutely do anything that you set your mind to. Absolutely. A says 2 attempts to pass the exam. Good luck. Thanks. A says I started the program before I found you, Blue, and I had already paid for, so I'm doing the best I can. And that's all you can do. That's what I tell people too. If you find yourself in these fast-paced medical coding programs and it's so quick, and what you do, finish it. You already paid for it. Don't lose money. All right. Just do the best you can. Get all you can from the school. That's all you can do. But make sure that you supplement your studies and find mentors or find tutors to help you so that you can set yourself up for success. Okay. Because not everybody knows this stuff. And sometimes people will look for things after the fact, right? After the fact, when they've already paid their money. So all you can do is just do the best you can. But I always recommend to go ahead and follow through with what you have in front of you. No matter how fast they're going, go ahead and go along for that ride. But just make sure that you are doing extra things or supplementing your own studies after that program is complete. Okay, at least that's what I recommend. Ellie says, thank you, Blue. Beth says, hello, Blue. I just wanted to share. Oh, my goodness. But you're going to take the second one, right? Or do you have another attempt, Beth? Misty says, yes, we are the 80s ladies. So you get it, yeah. A says, don't give up, Beth. And you know what to expect when you take it again. That's right, because you're starting with experience. Okay, you're starting with experience. Elvia says, I went through a 6-month program online and learned nothing. I think I need a program that explains and guides more in detail each chapter. What do you recommend me to do? AAPC or AHIMA? So again, AAPC is a 4-month, the coding portion is 4 months, and it will, it's going to seem like it's fast. And if you need somebody that's going to sit there and explain it to you, I don't know if they do that. Okay. And with AHIMA, it is self-paced. You get 1 year. But again, both programs are give or take $4,000 each. So if you're going to go that way, AHIMA has theirs online, and it is all, self-paced. But again, you get a whole year to take it. But you have to get in there and study too. You have to get in there and read those guidelines, so that way that you can do your part to understand. And again, if you're not understanding, then you need to find a tutor or find a mentor that will help you to kind of supplement that learning, so that way it will start to make sense. Okay, that's what I can recommend. I recommend either or. Okay, either or. But with AAPC, theirs is a little shorter, but you can pay to keep extending it, like if you need more time. But that is, it's entirely up to you. But with AHIMA, you get a whole year, and it's at your pace. And so if you're going to go slower, if you don't understand something, that's totally fine. But it's up to you. It's up to you. Katrina says, that's good. I didn't take any CEUs, and I was just looking at the ones I may want to take after I pass. Okay, good. Tuesday. Misty says, good vibes, happy. Tangela, thanks, Blue, positive vibes. That's right. And remember that, okay? Remember that. Beth, I won't give up. Good. I'm glad to hear that. I like seeing the positivity in the comments. I love that. Christina says, at Beth, depending on when you're taking your exam, if you need a study partner, we can study together. A says, AHIMA does medical terminology, I believe, and AAPC's medical terminology is an extra $1,000. So the AHIMA 13 course bundle does have the medical terminology in it. Okay, so that's something to keep in mind. But you have to pay for all those books with AHIMA too. So that's the thing. I thought it was included. You would think it would be included, right? But it is separate. Rebecca, I went through DeVry online. So far I like it. And I work in general surgery as a surgery scheduler. I'm learning so much. Well, good. And you're welcome, Elvia. Yeah, so Monday is going to be the CPMA. Tuesday is going to be about the CEUs. Those. I still feel like there was somebody's comment that I'm missing. Hate when I do that. Yeah, that comment was, unfortunately, I just signed up for a 16-week classes. What should I do now? No refund back. Stay with it. I said, as I mentioned in the video, if you find yourself in a program, just stay with it. Get from them what you can and study on your own as well, so you can set yourself up for success. My independent study video link is in the description. You can use it to supplement your studies, and you can add on that way, because having that will help you too. At least I think so. And we already talked about that. Jennifer said, how come courses through AAPC is only 4 months long when you strongly suggest 9 to 12 month course? Just curious. I was thinking of taking classes through them, but since it's only a 4-month program, should I look elsewhere? And I said 4 months long is only the medical coding part. That is not including the medical terminology and anatomy, which is sold separately. When you add it together, you get about 8 months, which I said in the video was fine. I was just referring to the programs where the whole thing, medical terminology, anatomy, and pathophysiology, coding, etc., was all in 4 months. If you want to go AAPC, go for it. As mentioned in the video, I can only recommend the associations themselves. And I said both are widely recognizable in the industry, and that is why I only recommend them. Yeah. So, I think that was it on the comments. Yeah. But, yep. So, hopefully, I hope that explains why. So people get it. I just want you guys to be set up for success. That's all. That's all. I just don't want you guys rushing or being sold something that you know it takes time. So that's why I want to say that. And yeah, it's not always the most popular thing to say, but I'm okay with saying it because I'm not here to sell you guys anything. I'm here just to give you guys the truth and let you know that, yeah, this is a great field. This is a very good field, very rewarding. But at the same time, you don't want to be taken advantage of because somebody's telling you something, okay? What books do you recommend to study? I have that whole independent study video, Elvia. When I update this video, it'll have the new thumbnail, and it'll have the link for the independent study. And that's got all the books I recommend to use. So, hopefully I answered everybody's question. Yes. I will be back for a show on Monday night, even though it is a holiday. But that's okay. I'll be here. Katrina. Blue, you said taking the exams online has a few cons. You were so right. Before I found your channel, I tried twice online and failed. The camera kept shifting and it wrecked my concentration. See, that was another thing too. People were asking me, do I recommend taking the online where you have the camera on you, or should they go to the site where there's like a proctor and then you get the free retake if you go to the site, you know, so in case something happens in the first one, then you get a free retake. But you have to wear a mask and you know you have to be there and things like that. And to me, I'm not going to want to be worried about sitting at home taking an exam. I don't want to, because the power could go out. You cannot move for that 2 hours and 40 minutes, 2 hours 45 minutes, or whatever, however long that test is. You cannot move from your seat. So what if you have to go to the bathroom? You know what I mean? Like, you cannot get up, you cannot move from there. Okay. And so again, you have to have the camera spacing you a certain way. And to me, you're already going to have your mind on the test. So why would you want to add extra stress with a camera setup? So I would rather go to a place and have the paper exam where I can go back and I can look at all of the ones that I had skipped, so that I could come back and look at them again towards the end of my exam. Because, you know, with the HEMA, they don't allow you to flag the questions. You have to answer the question and move on. With AAPC, you know, if you're taking it where you have to go with a proctor in person, it's a paper exam, paper-based exam. So obviously you're free to go back and forth on your exam. But again, if you're on the computer, you're on the computer. And if you're taking the exam with the cameras and setting them up, to me, that's just too much. Anything could happen. And I would not want to chance that day of anything happening. So that's why I recommend going to the place that is proctored, even though you have to sit there with a mask. I sat with a mask when I went to Pearson VUE to take my CCSP, because AHIMA has their exams administered through Pearson VUE testing centers. And if you've ever been to a Pearson VUE testing center, you know they're different everywhere you go. And so you have to wear a mask, and it was, I mean, it's just the way that it is. That's a setup. But I would much rather go to a place and take an exam rather than chance it and be in my own home and anything could happen. Okay, at least that would be my advice. Some people like the idea of being able to just stay at home and do everything from home. But you still gotta live life, folks. You still gotta be out with the people. And you still have to, do these things. And if you have to wear a mask, you have to wear a mask. You have to socially distance, you have to socially distance. That is just the world that we live in right now, guys. It's just the world we're living right now. A says, have a great weekend, Blue. Thank you. Rebecca says, some of my professors say we can't write out in the coding book, and some say we can. I would hate if I'm told I can't use my books for my certification. Any advice? What certification are you taking? AHIMA or AAPC? Which one? Misty says, thank you so much, and I hope you and everyone else has a great weekend. See you Monday night. See ya. Human says, thank you for a great show, Blue. Have a nice weekend. You too. Still waiting on you, Rebecca. Let me know. If you're taking an AHIMA, okay, AHIMA. If you read the candidate hand guide, which sometimes the professors, the teachers don't read the hand guide, because I've heard them tell their students two different things. The hand guide says some writing is okay, like for basic functioning, right? But if you're doing excessive writing, like if you're writing out coding clinics and all this other stuff, you cannot do that. That's a no-no. They don't want excessive writing because it looks like you're trying to cheat. But if you're writing like little notes, like maybe something to jog your memory or something like that, here or there, just little things, that is fine. Excessive writing is a no-no. So that's what they say. And you can look at the candidate hand guide for AHIMA, and it'll tell you that. It's the same thing with the tabbing, okay? The tabs have to have come with the original book, which is like with the CPT manual, the AMA CPT manual, they do have their own tabs. So it is fine to use those tabs, right? Because it came with the book. But you cannot do your own homemade tabs or anything like that. To me, the tabs get in the way, but some people feel like they can't live without the tabs. But with AHIMA, when I came up, those books had to be clean, and there could be no tabs. Didn't matter if it came with a book back in the day. Now they've changed it where you can put those tabs that came with the book, and you can use those on the book. But as far as like the writing goes, you can have a little bit of writing here and there, but they don't want you to have excessive writing. You can't be writing out coding clinics or anything like that. So that is what they're telling you that you can't have in there. I try to keep my books as clean as possible because the books already have the answers. It doesn't need you to add more to it. And I always tell people that when you're studying something on your own and then you go to take your exam, that has nothing to do with what you were studying before. So that's why I say leave your books as clean as possible. Skip all the highlighting, okay? The answer is already there. What you need to do is familiarize yourself with the book, so that way it doesn't feel so, you don't feel so lost when you're looking in the book. Because again, the book is going to have all the answers for you. You just have to know where to find it in the book. So skip all the writing, skip all the highlighting, and start concentrating on just looking at the book, looking at the pages. And even if you're just looking at the pages and then not reading everything, but just having it in your head where stuff is in the book, that's going to set you up for success. Okay, so that is just something that I recommend. I say that every time. Get familiar with your books, because you may not always use certain things, right? But if you know where to find it in the book, you're setting yourself up for success. At least that's what I say anyway. Kushni says, thank you for answering all my questions. You're awesome, Blue. Good night. All right, good night. And since everybody is telling me good night, I guess they're saying it's time to wrap it up, Blue. Thank you for tonight's information. You're welcome, Elvia. And thank you for the blue hearts. Rebecca, great. Thank you so much. All right, so I'm going to go ahead and wrap this one up. If you haven't had a chance to subscribe already, I hope that you do. Like this, because any kind of engagement is going to get YouTube to say, oh, she's got a lot of engagement, so let's go ahead and push this video out. If this video helped you, I hope that you will share it, and I will see y'all on Monday. Have a great and safe weekend, and I'll see y'all then. Bye!